Thank you, Mr. Chairman. And Secretary Sebelius, I've read your testimony and listened to it carefully today, and appreciate your commitment to making the website work. I'm concerned, though, that a lot of the discussion, your testimony and a lot of the discussion that we're in seems to imply that the problem we're dealing with is that we fouled up on the website. And we've hired a lot of experts. We're going to go get the website fixed, and then everything's going to be great. As the chairman asked you whether it wouldn't be better to hold off until we can get the website fixed, I want to expand a little beyond that, because I'm more concerned, frankly, not that you'll get the website fixed or not, but that we'll get the law fixed. And as I see it, we are now finding that the concerns that many of us raised before about whether the law was properly laid out and that the promises made about the law were real, our concerns about that are coming true. The president said, if you like your plan, you can keep it. And not because the website isn't working, but because of the way the law was put together, we now see that for millions of Americans, at least 3.5 million that we know today, they're getting canceled, 100,000 in Idaho, which is way more percentage-wise than the percentages that the president is now talking about. The president promised, if you like your doctor, you can keep your doctor. Again, millions of Americans are finding out they can't keep their doctor. The president promised, we can cut the average family's premium by about $2,500 a year. And although I read your testimony where you talk about premiums going down, I don't know what data sets you are using, because the data that I'm aware of show that the premiums in the individual market are skyrocketing. They're not going down, they're going up, and they're going up faster than they were projected before the law. The president promised if your family makes or earns less than $250,000 a year, $250,000, you will not see your taxes increased a single dime. I repeat, not one single dime. And yet we have, as we discussed then, somewhere between $800 billion and over $1 trillion of new taxes that were delayed in their implementation but are now starting to hit and squarely hit the middle class. My question to you is, isn't it time for a timeout? The law is not working as it was promised. The website's not working, fine, let's fix it. But the law is not working. Isn't it time for a timeout so that we can go in and start finding out why we are seeing premiums go up, not down, why we are seeing people canceled, not being protected in their health care, why we are seeing the failure of the promised operation of the law to occur?
Well, Senator, I would respectfully disagree with your assessment about the law working. In the last 3.5 years, there are millions of Americans who have actually received benefits under the law. There's 7 million young adults who have insurance now who were uninsured because they're now covered on their parents' plan. There's seniors who are experiencing not only additional benefits in their Medicare plan, but despite all of the accusations that somehow Medicare Advantage would cease to exist, we have a stronger and less expensive program today than we did. We have a 50% discount for seniors in their prescription drugs if they fell into the donut hole. Millions and millions of Americans who have private employer coverage now have no co-pays and no co-insurance for preventive care, everything from cancer screenings to immunizations. Those are all part of the law. And we have the lowest health care cost increases in decades in the private insurance market, in Medicare, in Medicaid. Costs are at an all-time lower rate of increase.
But Secretary Sebelius, you can go through those points, and for those data sets that you're talking about, some of those developments have occurred. But on the flip side, we are seeing millions of Americans lose their health care. Millions and millions more see their health care premiums going up, and the price for some of these fixes that you are talking about is phenomenally higher than we understood or was represented. Isn't it time to go in and take a look at the areas of the law that are simply failing?
Actually, Senator, in the marketplace, the rates have come in about 16% lower than what the Congressional Budget Office projected those rates to be.
That's the projection after, that's not lower than
I'm just
actual
saying
fact.
those were the projections of the rates. So the rates are lower, much like we just heard Senator Wyden talk about the projections around Medicare Part D. The rates came in significantly.
So are
lower
you
than
saying
what
that in
we
the
had.
individual market, insurance rates are going down?
I didn't say they're going down. I said the rates are lower than was predicted. And for millions of people in the market, they will actually, for the first time ever, have some financial help paying for their health insurance
We're
premiums.
going to have to move on here. Thank you very much, Senator.